some of them you are telling for physiology, no problem. Even that is also good. But mostly, so it is coming up for anatomy, right? Mostly, so it is coming up for anatomy. Okay. 1, 2, 3, 4. I mean, anything? Okay. But regarding the response, right? ऐसे silence तो नहीं चलेगा यार.
So let's go for one.
Yes, sir. First.
Yes, sir, for one.
Upper limb. And it is like just okay, mostly even in that all the responses there for the anatomy. Okay, done. Chalo, we'll go with the anatomy. Surely we'll take the physiology also. Right. My plan is, as I said, my plan is that going from 3 lectures, going on to the 4 lectures, even more. But if you pay attention, if you respond, if you cooperate, कि हाँ, yes, we are doing it. ऐसा blank नहीं होना चाहिए. तुम पढ़ाने का मजा नहीं आता. Seriously, I'm telling you.
Yes, sir.
Yes, sir.
Any problem, any
Yes.
genuine thing, health issue, something has gone wrong in the family, anything is fine, just talk to me. But it's a blank nahi yaar. If I say कि unmute yourself, then you don't even unmute. कोई तकलीफ है तो at least reply in chat. But not like this absolute cold blank. Histology we have discussed, but histology I'll be taking it in very much detail. Sparsh, the thing is anything which would align with a college. Now, I don't know, you all are going in different colleges, right? So if you got that detail, that what is the course curriculum, how the college would be proceeding, so then we can modify the things accordingly. But why upper limb? Because once you have learned upper limb, college even starts with lower limb. You'll be able to recollect that, yes, it is quite similar. You'll be able to compare. You'll be able to establish a bridge between upper limb and lower limb that yet it is understandable. So upper limb is like a beginning, right? Where things will be more or less like I always say, it is in 2D. So that is the flexion and extension, anterior and posterior. There are very few things which you have to understand on the lateral side or medial side. Very, very less, very less. But this way, you'll be understanding that this is the way to learn anatomy. Once you are fine, so then we can go ahead with the next of the regions, and they'll be going pretty fast, right? Because our focus will be going more towards the clinical side. So upper limb is final, right? Now what you have to do is, say on YouTube, right? Those who have joined late, so this is youtube.com and @ this I'm just writing for the understanding. Otherwise, so there is nothing like capital or small. All small, to then also you'll reach over there. You'll reach to the channel over there. You go to the playlist, right? In the playlist, and in the playlist, go for the anatomy, upper limb. Upper limb. Now over here, in most of the lectures, we'll be discussing about the anatomy. These lectures will be of 1.5 hours duration, right? Go through that lecture. So our next lecture would be on, say we meet on Tuesday, Thursday, and Saturdays. Right? Reply to. So our next lecture will be on Thursday, day after tomorrow. Day after tomorrow, we'll be going with the first lecture, what is present onto the YouTube. But if this is a 1.5 hour, we'll be completing that thing within half an hour. Right? We'll complete it within half an hour. So it will be a sort of a very fast, high-speed revision. Now, in case if you got any issue, if you got any problem, ये चीज समझ नहीं आई, We'll discuss that point at length, but I'll be taking it for granted that you have already seen this. Okay? Is it fine?
Yes.
Yes.
Yes,
Now,
sir.
Yes.
Yes, sir.
Yes,
Yes,
sir.
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 there are 130.
Yes, sir, it is fine.
So in that case, I'll show you CT scan, I'll show you MRI, I'll show you plain X-ray, and the day we'll be discussing the blood vessels over there. I'll show you even the angio, and I'll also show you DSAs, digital subtraction angiography. Now, I don't know if I told you or not that I got collection of more than 50,000 X-rays, right? More than 3,000 CT scans, MRIs. So I really want to show you, expose you to that material. So when you start watching it, and obviously it will be put into our shared folder, so you can always have that. So we'll be focusing on this clinical part, right? Not initially, but after some time, on one day, I'll show you how to take the history. How to take the history. History is his story of the patient. Patient is telling this is what happened, and how to extract the important points from that and come to a conclusion. All these things, they come by practice. So
Excuse me, sir.
yes.
Sir, actually, I got disconnected. Could you repeat what you were saying right now about?
Means at what point you were disconnected?
Sir, after the playlist thing.
So after the playlist. So this is what I said, that there is a playlist called Upper Limb, and there are lectures over there. So you have to watch those lectures in advance. Right. Say, for example, we'll be meeting on Thursday now. So Thursday, we'll be taking first lecture of upper limb. So you have to just go through that, and you have to watch that upper limb lecture 1, which would be of the duration of 1.5 hours. So just go through that. What we'll be doing on Thursday? On Thursday, we'll be going through this lecture at a high pace. Right? That means we'll be completing or we'll be revising. It will be a sort of revision. We'll be doing it within the first half an hour. But what if you are not understanding, or if there is any query? So we'll discuss those queries at length. Once it is complete, we'll be focusing on the clinical aspect, where we'll be talking about CT scan, MRI, X-rays, angio, DSA. Plus, we'll also be talking about the pathology. Idea? USMLE step 1 preparation, because this is the method to prepare for the USMLE. Right. In USMLE, they won't be asking you straight questions like choice 1, 2, 3, 4, 5. No. You have to really think, you have to really analyze, and then you have to come to a conclusion. So if every time we are practicing this thing, the imaging part, this is collectively called as the imaging part. So then it will come into your second nature. Second nature means even without thinking, you'll be able to diagnose so many things instantly on the spot. So, but that requires time, and that requires dedicated efforts from your side. And most important thing, you are through with the step 1, you are through with the step 2, right? And on step 3, how bad would you feel that if they say you can't speak even English properly, how will you communicate with my patients? So sorry, we reject. How bad would you feel? They don't say that you have to use a Shakespearean language, right? Very hi-fi, that Shashi Tharoor language. No, that is not needed. Even Siddhi Sadi simple language is enough, but you need to talk with confidence, and at the same time, you should be able to express yourself. Consider this thing as a home pitch. Consider it that whatever the questions which are asked, try to reply. Try to reply. If I'm asking that, okay, this is the lung, what do you understand by pleura? Who will reply? What is pleura? Right? बड़ा simple सा ही है ना आंसर तो.
Covering of lungs.
Outer covering of
Simple,
the
covering of the
Covering of
lung.
lungs.
Outer covering of the
हाँ, but collectively सबने बोला, let's pick up someone randomly. Chaitanya. Chaitanya. बस unmute करो यार अपने को. Just unmute yourself. क्या यार? Are there more than one Chaitanya? Dhruvi, Ganesh.
Hello, sir.
Good, good. I just wanted to know that you are unmuting yourself or not.
No, yes, sir.
Good.
What's the question?
Shabash.
Right.
Question is simple.
Yeah.
What is pleura?
It's the cushion between the lungs and the chest cavity.
It is
It is a cushion kind of thing between the lungs and the chest cavity, we could
okay.
say.
Now say you said that it is a cushion between lungs and
Chest cavity.
chest cavity. Okay. Now what you said is in fact very interesting. When you say it is like a cushion, right? Truly speaking, we can say like that. But that cushion effect, it has to be very solid. No? So this is a very
Yeah, it
narrow
is not
space,
solid.
very
It is
small
semi,
space.
yeah, and thin
So,
layered. Yeah.
but it is okay. But this space is very narrow. So the basic purpose of pleura is to create negative hydrostatic pressure.
Okay.
Hydrostatic pressure. Now, Dhruvi, do you remember? I gave you one example for this. What is negative hydrostatic pressure? That fruity ka dabba. When you put the
Yeah.
straw and when we drink and like a complete कंजूस, right? वो डब्बा टेढ़ा
Yeah.
करके adjust the straw and then take that
पूरा
last
पी
sip.
जाते
बेचारा
हैं. Yes.
डब्बा यूं पिचक गया.
Yes,
हंसना
yes.
क्या है यार, मैं भी करता हूँ, आप भी करते होंगे. मतलब we don't do it like stylish कि वो आधा पिया और रख दिया. मतलब in 5 stars so many people do like that. तो मैं तो यही गिनूं यार, ये this thing is what 450 का जूस, इसने आधा छोड़ दिया तो मुझे 200 रुपए का तो जूस छोड़ दिया. We calculate. क्यों नहीं? ना? This negative hydrostatic pressure is when the pressure inside is less, so that atmospheric pressure is crushing it. Same thing happens in case of lungs. Otherwise, so this pleura is stuck to the chest, right? So it is not allowing the lungs to collapse. It is not allowing the lungs to collapse because lungs, they feel that मुझे तो काम करना ही नहीं. I don't want to work. I just want to collapse. And chest, it feels like no, I should always expand. Right? So that's why pleura, it is like you take 2 glass slides, put the slight water and dono ko touch karo, and then you'll find that no, you won't be able to separate them easily. Right? It will be quite snugly attached. It is because there is no air inside. So that fluid, it created what is called as the hydrostatic. Hydro is water. Right? Static pressure, because pressure which is generated by the atmosphere, so it becomes quite sticky. They both stick to each other because of this pressure. There is no glue inside. Pleura. Okay. There are 2 layers of pleura, by the way. 2 layers. Right?
Visceral pleura.
Parietal.
Parietal pleura.
Very nice.
Visceral
Very
and
nice.
parietal, yeah.
Now, here it is lung. So which pleura is this?
Visceral.
Parietal.
Visceral.
It is
Visceral.
Visceral one.
Visceral.
It is near the organ, so.
That's right. Viscera means organs. Dhruvi, tell me honestly,
Yeah.
feeling good?
Yeah, sir. Absolutely.
Right? So now someone else. चलो कलश again. इस बार तो अनम्यूट करो. मोहन यार. चलो, now I'll unmute you. Should I? Unmute yourself. कुछ तो बोलो. Ashraf.
Yes, sir.
Shabash. So, this is good. Well, at this speed, person should be responding. Okay. So that is the visceral pleura. What is the name of the structure which is surrounding the heart? Similar structure. Heart is there, right? But then there is some covering. The way pleura is covering the lungs. That's right. You are answering in. हाँ बोलो बोलो अशरफ. इसका क्या नाम? कार्डियम तो है ही, because it is related to heart. So what is the name?
Pericardium.
Pericardium, right? Peri means
Pericardium.
surrounding. Pericardium, right? In pericardium also there are two layers, visceral layer and the parietal layer. Visceral layer which will be near to the heart. So then when two layers are there, so that means there would be fluid into. Correct. There would be fluid in
Pericardial
pericardial fluid.
Pericardial fluid.
Right? And that fluid is in very small quantity. Now, when that fluid increases, when there is more amount of fluid, right? More amount of fluid in this area. So this condition is not normal, right? This is abnormal condition. It is a pathological condition. I would like to give a name to it. What name should I give to this condition? आता है, सबको आता है. Take inspiration from lungs. हाँ बोल बोल. स्पर्श बोल. Great. Very right. It is called as the pericardial effusion. So now you know it very well that whenever the effusion word comes, effusion means it is collection of fluid into that potent space. This space is called as the word which is used is potent. Potent space, जहां पे collection हो सकता है, that place. Normally, fluid is there, but it is in very small quantity, so it is called as the physiological fluid. This fluid, अभी एक fluid यहाँ पे collect क्यों हो रहा है? Now see, this is like it's not like a dead fluid. जब जन्मे तब से whatever the fluid which is present over there will remain till the end. No, that fluid, it keeps on, its production keeps on getting produced. At the same time, it is absorbed. So that cycle, production and absorption, it balances, right? So at any given point of time, there is just a few ml, very small quantity of fluid is there. So when we say that effusion, right? Effusion means collection, more pathological collection of the fluid. That means fluid has increased in this space, right? In this potent space. Potent means कि ये जगह जहाँ पे fluid collect हो रहा है, the space where fluid is getting collected. Now tell me what can be the reason very grossly. There are two processes. There is A, there is B. So process A is production of fluid. Process B is absorption, right? This is production and this is absorption.
Sir, infection.
नहीं ऐसा नहीं, वो तो बहुत ज्यादा.
More
We say
pressure
it
in
like
blood vessels.
More production of
Pressure in
A
blood vessels.
and
Less absorption.
For
ये ना.
absorption, there can be a microvilli like
अरे यार इतना भारी मत सोचो. मतलब अभी मेरा बाथरूम रिनोवेट हो रहा है तो पानी कलेक्ट हो रहा था, राइट? सो व्हाट कैन बी द रीजन? ओनली टू रीजन. वन, ईदर देयर इज मोर, पानी गिर रहा है कहीं से ज्यादा, मोर वाटर इज कमिंग एंड लेस वाटर इज एग्जिटिंग, देन एंड देन देयर वुड बी कलेक्शन, है ना?
yes.
yes sir. Yes sir.
Yes. Over here, there is increased production or there
less
can
absorption.
be decreased absorption. Increased production कब होगा? Inflammation, right? क्यों? Because body would say अरे RBCs, WBCs आ जाओ जल्दी जल्दी लड़ना है, right? And when it occurs like there is decreased absorption, when the outlet is blocked, right? When that gutter line is blocked for some reason, obviously थोड़ा पानी गिरेगा तो भी it is going to get collected. Even if this is normal, right? Even if this is completely normal, but if the outlet is broken, right? If the outlet is blocked, if there is lymphatic drainage blocked, then back area that will keep on swelling, it will keep on getting collected. This is the basic principle of collection of any fluid. Basic principle, right? Then we'll be implementing the knowledge of congenital traumatic inflammatory neoplastic, and then we can give all sorts of reasons. But in the back of our mind, it is like we are very clear that there is increased production. That's why it is getting collected. There is decreased excretion or decreased absorption. That could be one of the reasons. At least this point is clear to everyone.
Yes, sir. Yes, sir. Yes, sir.
अच्छा. Someone has to.
Excuse me, sir.
हाँ बोलो बोलो बोलो.
Sir, could you please repeat the order that you said it? That you said it in congenital, traumatic, and after that?
Okay. It is congenital, traumatic, inflammatory, neoplastic. Neoplasm means new growth, right? Neo means new, plasm means growth. And miscellaneous. This order, right? It will be helpful to you till you come for your whole life. And in benign, we have got in neoplasm, we have got benign
Malignant.
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 and malignant. And when we say benign means it is
At one place.
Stick to
At
one
one
place.
place.
it increases its size, it can cause compression effect, right? But it won't spread. When it is malignant, so in malignant, this
It
tissue
spreads massively the body as well.
right?
Not confined to one particular place.
Yes, it will not be confined to one particular. So now, in malignancy, right? When we say malignancy, so there'll be primary and secondaries. Primary means if that person has got, say, CA breast, right? So then it is known that from that, it can go to the opposite side, right? It can go to liver, it can go to spleen, and it can go to bones. So how do we really see that? We will be able to see a very dotted appearance, and it spreads into the lungs also, right? So these are called, this is what is called as the primary, the main where the cancer has occurred, and it has spread to these areas, so that's why they are called as the secondaries.
So, what is the basic cause of malignant and benign? Like, what is the difference of cause between them?
So this is basically like a growth, right? The growth which is uncontrolled growth. We just say it uncontrolled growth. The growth which is not in our control.
Yes,
When
the
this occurs, now there is a
metastasis is
cell
not
cell
in.
cycle, right? There is a cell cycle, cell grows, develops, matures, and then at one point of time it goes for apoptosis, self-death. It declares that I'm not now of no use to the body and I should exit, and it dies. That is what is called as the apoptosis. Right?
Yes.
Apoptosis, which is a scientific word for suicide. So cell dies, but it has got a reason. Now, what if this process stops, apoptosis stops? So in that case, there is increase in population. Right?
So that will be metastasis.
Yeah, so the
We can't, no,
metastasis would
this is
stop.
growth, right?
Yeah.
Metastasis, I'll come to that. So this is the growth. Now, growth can occur in multiple ways. So one of the method is in which there is only increase in size. So that is like a benign growth, which is well encapsulated. So even when you do surgery, you have to take this entire thing and block. That is full block, right? It should not be cut, and then taking the piece by piece out. No, it has to be taken full block. So that is in case of benign. In case of malignancy, right? In case of malignant, this wall itself is weak. So that's why those tissues, right? They will start traveling and they will reach to various areas. And there they settle and then they start growing. So these are called as the secondaries, or the name which you'll come across it is the metastasis.
Metastasis.
Metastasis. Metastasis means secondary growth, right? That's why they are also called as secondaries. And in report, you'll find the word metastasis. So that you treat the primary cause. But if the metastasis, if the cancer has spread to multiple areas, then it won't be possible to treat, right? Or it is very difficult, but the prognosis is very poor. So prognosis is what? Prognosis, $1 million question. When the patient's relative tells, Doctor Saab, theek to ho jayega. and then you say कि क्या बोले हाँ कि ना. That is called as the prognosis. Prognosis means chances of recovery. Right? Chances of recovery. So this is the first thing which should come in the mind. So like you come across a patient of heart attack, right? And then you do the MRI, and in MRI you find that in the brain, right? In the medulla oblongata itself, right? There are all those dark spots. That means that portion is damaged. It means this person will never be able to breathe by himself. Never ever. That person is in deep coma. So that person won't be able to say breathe by himself. The moment ventilator switch is turned off, within under 2 minutes, this person will leave this world. So this is in such case when you know that okay, things are like you see the MRI and then you find that it is like that. So in such cases, the prognosis is poor. Or in other cases, sometimes you find that okay, because it is located in one region, so you said though no chances अच्छे हैं, right? Don't worry about it. So movies में दिखाते हैं, so that prognosis is like this, right? कि अब तो भगवान ही सहारा है, etc. etc. And then ठीक हो जाते हैं. हाँ बोलो.
Benign could be transferred to malignant.
Benign usually, so very, very intelligent question. The thing is benign usually won't be transformed to malignant, but there are certain things, say, बहुत popular जो है, that's what I'm telling you. This is liver, right?
Yes.
Have you heard of fatty liver?
Yes.
Yes, sir.
Excess amount
Yes.
of
Excess amount of fat. The moment you put the ultrasound probe and within seconds you come to know that there is change in the texture of the liver, right? That is fatty liver grade 1. Grade 1 is the beta संभल जाओ, right? नहीं संभलते. Pizza, pasta, बाहर के सब चालू. It moves to grade 2. Grade 2 is where it starts giving discomfort, right? But when it goes to, now this is benign, up to this point of time, it is benign. And at the same time, the vital thing is not only benign, but it is reversible. This is the vital thing. यहाँ पे भी सुधर गए तो yes, liver will go back to completely normal stage, nothing. But then grade 3 and then the grade 4. It was grade 4.
Basically, fatty liver is cancer.
Fatty liver is not cancer, but it is considered as precancerous. It can convert to cancer.
So the cells, there are proteome.
Because then it is like, say, this is the house, right? In which there are, let's say, 3 or 4 family members. What if 15 जने आ जाए रहने के लिए? खाने के लिए आके गए, that's okay. But now तो they are not going back. So over here, they are consuming all your resources. रसोई वसोई में जाके सारा खाना खा लिया, right? Everything is occupied. TV वो देख रहे हैं. You are not giving. So you are not getting any chance, even in your own environment. This is what really happens in case of carcinoma or the cancer. They eat away all the resources, and that's why the first thing which you will ask to the patient of cancer, or he would say, कि सब कपड़े ढीले हो गए हैं. Why so? Weight loss. There is weight loss. He is not getting nutrition. The nutrition is consumed by those gundas. So there will be clear-cut weight loss, and that is extensive. And as the time passes, it becomes more and more and more.
Sir, fasting reduces the chances, right? Of
Yeah, I know. 2 years
Also,
back.
the cutoff of the carbohydrates and
Carbs.
glucose.
Very right. Say carbs. Carbs if you cut. So then that is, but see, in carbs also, there are 2 types of carbs. Some
simple
carbs,
and complex.
simple and complex. So if you are taking complex carbs, so that is wonderful. Because it will be taking more time to process, but at the same time, carbohydrate, it gives you so much of energy, so it is needed. But if you're taking simple carbs,
Sir, fruits come under simple or complex?
fruits, they come under simple carbs. But the thing is that they get processed fast, but the amount of calorie, the sugar spike, I mean, if you are having, say, 5 banana,
GI, glycemic index, right?
5 banana एक साथ खा लिया तो वो बात अलग है. But otherwise, fruits in reasonable quantity, it is fine. At the same time, if you know that, okay, today's target is to run, say, 15 kilometers. To fuel yourself properly, right? You have that, you can have even bread also, right? To make a nice, but not the, अपने कैसे रोटी कभी अकेली नहीं खाते, रोटी सब्जी, it is always roti sabji, right? Because it is a very good combination. Roti is carbohydrate, but sabji is lots of fibers. So it is like we should be eating roti sabji, but sabji should be more. It should be more. Itni sari sabji, roti kam. So then automatically you will be able to get better energy. Say for example, dates, khajur. It is wonderful. रेस के लिए रेस में भी देते हैं during the race, but say it will take about 15-20 minutes before it comes into circulation and starts giving you the energy. So that's why you need to plan your energy accordingly. How many of you have started workout, even if it is 10 minutes a day?
Sir, I have started.
Sir, I just sent you my report in message.
Message. There are so many, more than 30 messages. Acha. The email, reply to that email. Okay. Good. Number is good. Reply to that email, and it was asked about the consistency.
Yes, sir.
Right? Very honestly, you said that you are very much motivated. You do it for one day, you do it for second day, you do it for third day, and then you feel like, chalo, aaj cheat day.
Yes,
So
sir.
that day you should just go through, like, I think I personally do it.
Then it breaks. And it happens with everyone. What you really need to do is, pehla to cheat day nahi. It has to be a reward day. There has to be a reward day. A reward kya? Decide before. Before you start any of the exercise, decide beforehand that what would be your reward.
Yes, sir.
What will make you happy? Bas. So if you say, just giving the example, that let's say you started with skipping. पहले दिन तकलीफ हो रही है, right? 15 हुए, 20 हुए, 50 हुए. You feel like the day I'll hit 100. And let's say you like club sandwich. The day you do 100 without any gap, right? This is just an example. You are allowed to go and have this.
Yes, sir.
So this will not be a cheat, this will be like a reward. Because when you take it in the form of reward, so your brain will be releasing happy hormones. It will be releasing happy hormones. When you are doing a cheat day, after eating, you feel like, ye kyun maine khaya? Right? So your brain will go into depression. Never do that. Right? Let it be a reward day. 3 दिन पे नहीं हुआ, कोई बात नहीं. 4th day, 5th day. But because the reward, that club sandwich is खड़ी है ना सामने. So you will definitely be performing better and better and better. And one day you will hit the target. The moment this has been received, right? You enjoyed your reward also. Set the next goal. Set the next goal and put that goal bigger. Say 500 skippings.
Yes, sir.
So that way, you are the only competitor with yourself. You don't have to look at others for the competition. You are the competitor of yourself. But this is the secret. This is what I do. And
Yes.
always keep a diary, whether digital or physical, but keep on writing what was good, what was not good. Keep on writing. Anything which is written, it is considered as documented. When the things are documented, it will affect your brain.
Yes, sir.
If not more, 2 lines, 3 lines. मतलब अपने आप को गाली दे दो कि यार आज मैंने एक्सरसाइज नहीं की और इतना सारा खा लिया, राइट? बस कुछ नहीं. Then don't write in very sophisticated language. No, from tomorrow onwards I'll do this and that and अरे कुछ नहीं, ये सब कहने की बातें हैं, राइट? कहने की बातें. मतलब
Yes,
कुछ
sir.
चीजें आई डोंट नो, इवन इन मूवीज दिखाते हैं. मतलब वो देर आर, मतलब अड्डे पे पहुंचे, उसको उठा के ले गए, राइट? इतने गुंडों को मारा, यहाँ मारा, देश में सो मेनी फायरिंग, सो मेनी किल्स, एंड देन फाइनली यहाँ पे, राइट, उसको छुड़ाया. वो वह गले मिल के बात करे, अरे ये हुआ वो हुआ, अरे भाग यार. द लॉजिक इज लाइक आई मीन्स दे डू
Yes, sir.
दैट ऑल सॉर्ट्स ऑफ ड्रामा. इमेजिन द रियल सिचुएशन. वो मतलब वो थोड़ा ना अरे भैया करके वो गले मिल रहे हैं, अरे भाई भाई बाकी भाई लोग आ जाएंगे. पर या दैट आई जस्ट सॉ इन सम स्टूपिड मूवी. मूवी देखते हैं क्या? बिल्कुल देखते हैं. क्यों? व्हाई नॉट? हाँ, बिंदास. हाउ समवन कैन रिवर्स फैटी लिवर कंडीशन? Eat lots of green vegetables, lots of green veggies. Bindas, खूब. Very important.
Sir, how can we determine if that cancer is malignant before it has spread to other organs and it is worse?
Yes, one thing, say, अगर जो if it is malignant, the weight loss is inevitable. There will be definitely weight loss and there will be severe breathlessness. In benign, it happens, it becomes apparent when the size has increased so much. When the size has increased so much, then person realizes. Or if the person is very much conscious. Say, I'll give you the example. It is said that every female should know how to do the breast examination because it is one of the most killer carcinoma, most common, right? In case of females, carcinoma breast is so common. So why it is said that self-examination? Because even if there is development of even a small nodule, so it will trigger that, okay, I need to go and get my mammography done. It is called as the mammography. So in mammography, normal X-rays, they won't be able to see because this is the complete soft tissue, right? So in mammography, the entire X-ray beam and all those settings, they are very different. They are towards the soft tissue. And in mammography, you'll be able to see even the small structure also, right? All the ducts and everything. So this will give you the indication. Then obviously, if any tissue is found out that, okay, this is a doubtful thing, whether it is malignant or benign, just from simple mammography, it is usually not that easy. Not easy. So that's why on the safe side, what it is done, that, okay, madam, we need to go for what is called as the biopsy. The full name, it is called as the FNAC. It is called as FNAC. FNAC is fine needle aspiration cytology. Aspiration cytology. Its meaning is what? That you'll be using a very fine needle because you don't want that tissues should be damaged. So it's a very fine needle which goes inside. That needle goes inside and then it is like a double needle. Right? So it goes inside, then this inner part, it is taken out. So this is the edge. This acts like a blade. So it reaches over there, it cuts the tissue, and then that tissue is taken out. This is what is called as the biopsy. This biopsy could be, it is never a blind biopsy. It could be USG guided. So that means parallelly you are holding the probe and you will be able to watch the needle also, and pinpointedly needle goes to that tissue and then takes the tissue and comes out. Or it can be a CT guided biopsy, right? Can it be MRI guided also?
No, because
No.
needle will
No,
just
sir.
Because needle is
Because the
metallic.
needle
Nice.
will
Yes.
affect almost.
No
The
matter.
needle will act like a bullet. It will act like a bullet, right? So yes, it is USG guided or CT guided biopsy, and it is called as fine needle aspiration cytology. That tissue is taken out. It is put on the slide, right? It is put in its container, sealed, and immediately sent to lab. They will be staining it, then they'll make a block out of it, and from that block, they will, using the microtome, they'll make the slides, and then the examination will be going, right? So it is the microscopic examination which will tell you what type of tissue it is. So in histology, we see the normal structure, right? So when I'll be showing you, say for example, we are talking about liver, so we'll take the liver. So if we are talking about liver, so I'll show you the normal, healthy, good liver slide, right? Where we'll see that, okay, this is how the triad is formed, and this is how that entire hepatic tissue, hepatocytes, they are lying. So this is normal. But at the same time, we'll also be watching some of the pathologies. So in first MBBS, no one is going to ask you for the pathology, but we'll be watching it parallelly, because when you have learned about the normal liver, so then brain is very excited because brain has seen this thing for the first time. So immediately you see some pathologies, not all the rare and very complex pathologies, but you see it, you'll always remember. You'll always remember. You'll feel so good, कि yes, this is the practical implementation. Otherwise, still the second MBBS comes, दिमाग में होता है यार इतना पढ़ रहे हैं इसका use क्या है? But the moment you know that yes, it is so useful, say these things they can occur and they are so common. They are so common. So now you know that this is the importance of what I'm studying, and this will motivate you so much that you will never be like kal padhenge. No, let's read it, let's do it now. That would be the difference. Right. So very simple सी चीज है. This is what I really do for the consistency. For consistency, write in diary without fail. Right? Always write. And then this reward.
Sir, diary solved my overthinking problem too, and to a
The
very
diary
good
क्या?
extent.
Again क्या? Diary.
Solved my overthinking and
Oh yes,
anxiety problem too.
it helps a lot. It helps a lot.
Yes, sir. Thank you,
And
sir.
say in diary, right? In diary, what are the symptoms?
Like I just write ki, okay, I overthink this. This was the reason, and this should be the thing I should be doing. So it's just more critical thinking there, rather than keeping on thinking what should be done, what should be done.
देखो यार, you seem to be a very intelligent guy. मैं तो simply इतना बोलता हूँ, किसी को गाली देनी है तो डायरी में गाली दे सकते हैं. So नींद अच्छी है. Bindas, you can write
Yes, sir.
everything and anything. Right? See, there is something like what is called as social inhibition. साला किसी को कुछ sorry, right? कुछ बोलो तो then you have to think, okay, यार ऐसा बोलना चाहिए, बोल सकते हैं, नहीं बोल सकते, right? So many things occur. डायरी में तो बिंदास, right? You are the boss. जो लिखना हो लिखो. And as no one is reading that, so no one would be judging. Otherwise, तो आप बोलो, आती है मेल, I'll show you. मैंने कहा सर आप गाली बोलते हो, कैसी गाली बोलते हो? मैंने कहा बॉस कौन सी क्वालिटी की सुननी है? उसके लिए ऐसा गुनाह करना पड़ेगा.
Level बताओ.
हाँ लेवल वही ना, कौन सी चाहिए?
Sir, but maintaining a diary in an Indian house is
Write
अरे
notes
दोस्त
in
वही तो मैं बोल
Samsung
रहा हूँ,
notes.
तो डिजिटल बनाना, मेक इट डिजिटल. इंडियन हाउस क्या मतलब, से इफ यू आर अमेरिकन एंड इफ यू आर राइटिंग ऑल सॉर्ट्स ऑफ थिंग्स, तो योर पेरेंट्स वुड से वाओ माय किड इज सो क्रिएटिव.
no.
ऐसा क्या बात करती है? It is like humans are humans. But the thing is कि when you write, तो people start judging you. मेरी एक स्टूडेंट ने उसने कहा कि मेरी रूममेट ने मेरी डायरी पढ़ ली, तो कहते कि नाउ कह के सब उसने वो डायरी वापस जाके सबको दिखाई. तो कहते मैं तो सब लिख देती थी. I say now be bold, be so bold कि अब मेरी डायरी वापस नहीं की तो नेक्स्ट नाम तेरा आने वाला है और फिर देख क्या लिखती हूँ और वो मैं सबको पढ़वाती हूँ. Happens sir. Then you write, हाँ इसका सोल्यूशन तो निकालना पड़ेगा. और सी द बेस्ट पार्ट इज पता है क्या है, मीन्स यू हैव टू बी वेरी श्रूड. पता है ना कि यार चलो रूममेट की बात कर रहा हूँ. रूममेट, राइट, रूममेट, आप जल्दी सो जाओ और रूममेट आपकी डायरी पढ़ रहा है या पढ़ रही है. नाउ यू नो दैट ना. तो जस्ट जस्ट
तो
बी अ,
शर्म आ जाएगी पढ़ते
अरे
पढ़ते,
नहीं दोस्त, बी अ रॉ
उसके
एजेंट.
बारे में ऐसे
पता
लिखो।
है कि ये खबरी जो है ये फूटा हुआ है, तो फीड दैट इंफॉर्मेशन जो काम करवाना है, राइट. उसके पास से मसाला डोसा खाना है तो देन डायरी में लिखो कि अरे शी सो नाइस ये वो, राइट, मुझे ऑफर करती है कि खाना खिलाएगी ये वो. ऐसा ऐसा लिखो यार, शर्म के मारे वो खिला, चल चल मैं तुझे खिलाने ले जाती हूँ. और गाली देनी है तो भी उसमें दे दो, मतलब वो पढ़ के किसी को दिखाई ना सके कि यार मुझे ऐसा लिखा है. ये तो बड़े बी लाइक दैट एजेंट.
थिंक आउट ऑफ द बॉक्स।
सो एक है व्हेन यू राइट, your your thought processes, they will be going in very good direction because it is emptied. When the cup is emptied, then it is possible to put so many good creative things in that. Must चीजें. Then you automatically become more productive and creative. And best is, this is my experience, रात को नींद मस्त, एकदम फर्स्ट क्लास. अदरवाइज वो दिमाग में थॉट्स चलते रहते हैं. So अभी next time के लिए, for next time, right, we are starting with upper limb, right? That will be the first lecture, and do go through it. And then what we'll do is we'll be learning some very good clinical things, because even in upper limb, right, you just see the X-ray. The most fantastic thing which we'd like is fractures, various type of fractures. This is the symbol of the fracture, right? So this is the symbol of fracture. We'll see various fractures. And some of the very favorite questions are fall on outstretched hand. मतलब किसी को धक्का लगा, केले की छाल पे से फिसला तो वो ऐसे पीछे गिरेगा, right? True, right? So it will fall back. But अगर जो staircase पर से गिरा तो वो सीधा ऐसे गिरेगा. So this is called as fall on outstretched hand. The first injury is scaphoid. Right? Scaphoid. So that's the beginning. So then how the weight transmission goes all the way up to the clavicle, that is one of the very fine thing to learn about. And apart from that, for all the males, let's say if you really want to increase your power, say किसी ने हाथ मिलाया तो he should really feel, right? That thing should not be attempted on a girl, right? But when male to male, when you shake hands, so your grip, that is actually an indication that how strong you are, right? So grip should be very strong. Help not only in the sports, but as such, it will keep you very fit. When we'll be discussing, I'll talk you about what is called as the super grip. I'll show you also. I got the super grip. Super grips are nothing but when you do the weightlifting, right? So there is a normal rod, but these are the extra coverings. So these extra coverings, they are very short, right? So you can put it even on your kettlebell or you can put it on even your dumbbells. But now you have to really hold it like this, right? Because it is, the rod is small, so you can just grip it like this. But when you have put that extra tough rubber, so then you are holding it like this. When you do it like this, it will start developing. It will start developing your forearms, your biceps, right? And the weight transmission will be so beneficial. You'll be so strong, right? Same number of reps. So these are what is called as the hacks, biohacks. So that way, so in upper limb, we'll be discussing lots and lots of things about the exercise also, right? So for every section, say people focus on biceps and triceps, we'll be focusing on brachioradialis, right? A very powerful muscle. So when the brachioradialis is strong, you'll be amazing in so many sports. At the same time, your power, that would look amazing. So that's what we'll be starting from the next time. And again, please to all the friends जिन्होंने आज तक एक बार भी unmute नहीं किया, can you just unmute कोई भी randomly? I'll not take the name. मतलब any one of you who feels like till today I have not spoken even once. Can you just unmute yourself and say whatever you want? Anyone?
Hi, sir.
Hi. Yes, Preeta?
Uh,
Okay. So what made you say, feel ke chalo, let me unmute?
it's been a while. I was not able to attend the lectures, and I guess on last lecture, I think it
Mhm.
was on Saturday,
Mhm.
you were calling my name, but
Okay.
I was traveling, so I was not able to answer you, and I had some network issue, so I have to leave the lecture. So I
Shabash.
thought I should just say hi.
Very nice. Very nice. Proud of you.
Thank
Thank
you,
you.
sir.
Thank you. Good, good, good. Anyone else? Aha, sure, sure. Bus. Anyone else? अरे
Good
यार.
morning,
Hi,
sir.
sir.
हाँ, चलो चलो अब. Yes, yes.
Good morning, sir.
Good morning.
Sir, this is my first lecture.
Today is your first
Yes,
lecture?
sir. Yes, sir. I was shared the link late. I was shared the link on Saturday.
अच्छा. Okay. Okay.
Yes, sir. So I do not have your email ID and I do not know how to access the PDFs.
No worries, no worries. How will you feel? I'll say, okay, send a mail to me.
Okay, sir. I'll send you a mail
अरे
today.
क्या ओके किस ईमेल पे एड्रेस भेजोगी मैसेज
No,
भेजोगी
that is why I asked you for the email, sir.
It is
I
this.
sent you a message, but you did not see it.
हाँ but see there are more than 65 messages so till your message till your MBBS हाँ right this is
Sir,
T at
all
MBBS.
caps or?
No, in email there is nothing like caps or small. This is just for the understanding so that there is no error, right? At the
Okay,
rate
sir.
it is Gmail.
Okay, sir. Sir, and how am I supposed to access the PDFs, lecture PDFs?
Okay. Say there is a Google Drive. I'll send you the link, right? So that's a Google
Okay, sir.
Drive. In that Google Drive, there are PDFs. There are some books available, right? I put the books also. And do
Okay,
send
sir.
a mail to me. In playlist that is upper limb, right? And you just listen to first lecture. It's
Okay, sir.
completely fine that if there is not clear, so just make a list of doubt, right? That this
Okay,
is
sir.
not clear or this is not clear. No worries, we'll be taking it in our lecture. The whole idea
Okay, sir.
is
Thank you so much.
this. This is how we approach that when this is our base, once we clear our base, then and then we move on to the next step. But when we move on to the next step, we try not to repeat this thing because that's how we keep on progressing further and further and further. But our every lecture will be based on all the previous lectures. Right? So at no point of time it will happen like that something is coming out of thin air and without any foundation. Right? It will never ever happen. Sai,
Okay,
go
sir.
ahead.
Thank you so much.
Thank you. Most welcome. Yes, Sai, go ahead. Bolo, bolo.
So I have to leave in maybe 2 weeks later to Georgia.
Mhm.
How am I supposed to attend your lectures there?
Same thing will be with everyone, correct? In some in 2 weeks, some in 3 weeks, some in 1 month. So when it over there, as your schedules are ready, na, just let me know. From this, we'll shift to Saturday, Sunday lectures. On Sunday, it would be a marathon session. It will be a long session because our idea to complete these many topics, now it will be squeezed to 2 days. From 3 days, it will be squeezed to 2 days. In case if we come across that, okay, there is some vacation, right? 1 week full vacation, so then we'll be utilizing, say for example, Christmas. So we can utilize that time full-fledged, keeping the lectures every day, right? So that we can proceed faster and further.
So, sir, I have to wait till others get their schedules.
But see, more or less, it is like it's a matter of 1 week here or there. So everyone will
Okay,
be
sir. Thank
traveling.
you.
So no worries.
Sir, do we have to watch the upper limb from YouTube like beforehand or?
Beforehand, obviously, beforehand. Because say when I'm telling next time we'll be going for first, so you have to watch it beforehand. There is a link, so you'll be getting the PDFs also, right? You'll be getting the PDF also. Once you get the PDF and you see the lecture and you find that there are 3 doubts, right? Write down the doubts. Don't send a mail, or you can send the mail, right?
Okay, sir.
But on that day, I'll make you speak. Right? I'll keep the list of all the doubts, but I'll make you speak that yes, you talk, discuss it with me. So that way it will improve your confidence. You'll be able to express properly. I mean, you are fine, but this is
Yes,
in
sir.
general, right? This is in general for everyone. So that's what we want, that you should be able to speak very comfortably. That's what is asked in USMLE Step 3, whether it is PLAB or whether it is MRCP. In all those, they watch your communication skills, that can you really talk? Bus.
Yeah, sir. Okay, sir. Thank you.
All right. Now,
Excuse me, sir.
हाँ बोलो बोलो.
Sir, when will you starting the fitness batch, sir, as you said?
Fitness. You guys decide, yaar.
Sir, on fitness, I just remembered I wanted to give you the report of my weight loss. I lost 15 kgs in 3.5 months.
Nice.
Now I am at 98.5 kgs.
Okay. So you must have cut the
Carbs.
carbohydrates.
Carbs, and I just eat one meal made by my mother, and other 2 meals are made by me, so the oil is also controlled.
That is a luxury. इस घर का खाना is a luxury, पता है?
Yes.
One more thing you can do.
Yes, sir.
Say, what's your eating window?
In the morning, I eat something very light, like
That's okay, but at
100,
what time?
200.
That's okay. At what time?
9 to 10. Breakfast at 9 to 10. Then
9
lunch between 12:30 to
And when is your
1:30.
last meal? When is your last meal?
Last meal 9 to 10 at night only.
9 or 10, na?
8, yeah,
Sometimes
9 or 10.
Bas, that's the trouble.
In between 9 to 10, we can
That's
say.
okay. Chalo, even if you keep
Okay.
it 9. Look, you do 2 things. Shift this thing to 7 p.m.
So that's the problem, that can't be done. The dinner itself is like the mom makes it, so it's always ready around 8:30 p.m. At minimum, it's ready at 8:30 p.m. because of the duties and all.
So make it by yourself. And in dinner, take some मतलब sprouts में तो कुछ करना ही नहीं है. You can make it by yourself. Paneer, and then अपना onion, tomatoes, just chop them, right? Shallow fry, saute, right? What we call as saute. Do it with some olive oil. That's it. Have it. Make it by yourself and eat it. The reason behind it is this. When you finish your dinner by 7, this is 14 hours. For these 14 hours, you'll not eat anything. Nothing. No sugar, no tea, no coffee, nothing. Just plain simple water. At the most, if you want, you can have lemon juice. That also. And in case if it is uncontrollable, so then you can have apple. But that is only in rarest of the cases. But otherwise, increase this window to 14 and then gradually take it to 16. In order to take it to 16, you have to make this thing early. अब जब ये यही बनाना है, then why not to make it by 5:30? And that
फिर
thing
बाद में सोते समय कितना भूख लगेगा?
लगेगा, but that is what is needed. That is what is needed. And सोते कितने बजे हो?
12. It's like always 12 o'clock.
Ajay, that's why, because on BBC, I was watching the news. So, along with Narendra Modi, then Russian and Chinese minister, you were also there, right, regarding how to tackle these tariff, because that meeting occurred as per the Indian time at around 11:30. So that's why you got late. You know?
No, sir. Sir, not because of that, but it's
दोस्त
just
गाली
been
क्यों
like,
खाता है? 12 बजे तक क्यों जागता है?
Hello,
I
sir.
don't know, sir. Just family schedule.
अरे कोई
It's now
family
been normalized now.
अरे कुछ नहीं.
Like till 11:30, lights are not even lights are off till 11 o'clock.
Sir,
आंख
according to you,
बंद
what
कर
is
लो,
the
लाइट बंद
ideal
हो
time to
गई.
sleep?
आंख बंद कर
Yes,
लो,
sir.
लाइट बंद हो गई. Say, if you don't take any sleep before 12 o'clock, right? Just do that. 12 बजे से पहले. I go to sleep by 9:30. 10 तो is the limit. 10 बजे तो खत्म, right?
Sir,
मतलब,
at 10 we start the procedure of sleeping like
I know that you get a call from Jinping and this Putin, right? Because of the time difference. But ठीक है. मतलब, tell them that wait till morning, right? We'll take the decision then. And say, I think simply because of your meeting with that Modi sir, market is up. So I'll keep in touch with you, right? For any of the
okay, sir.
information.
Sir,
थोड़ा सा
I'll
बता
I'll
देना.
try sleeping at 10, sir. Don't be
हाँ, तो ठीक
sarcastic.
है.
Sorry.
And try to wake up early. Try to wake up early. It'll make a big difference. Because from 4 to 5, when we say it Brahma Muhurat, right? As it is written in our Ved. Brahma Muhurat is because it is during this phase when there is pineal gland secretion. Pineal gland secretion is like a booster for your brain. So that's very crucial.
Also, sir, for the life longevity, it is responsible, I think.
Absolutely, absolutely, absolutely. Very true. Very true.
Sir, sir, I want to add one thing, sir.
Ah,
First of all, sir, my name is Nirmit Das.
shabash.
So, sir, in ancient times, the people used to eat their food, dinner by 6 o'clock and before the sunset to for their longevity life in ancient
You are
times.
million% right. It is what
Yeah,
they
sir.
say is, it is called as, it means there is no English. English ka karun, the English word ही बेकार है. It is called as Jatharagni. Jatharagni is
Yeah, sir.
Jathar, मतलब अपना जो stomach है. Actually, it is like that our stomach starts secreting less acid as the sun sets. It is because of the circadian rhythm, right? The circadian rhythm, which is in tune with the amount of light which is received by the retina, and then it is sent to the brain, because retina is part of the brain. And rest of the systems, they are controlled by the brain. So there is less amount of secretion of the acid. So anything you eat after the sunset, basically they say that it is like a wish, it is like a poison. So that's the reason that by the sunset, before sunset, if you finish your dinner, right? कुछ नहीं, रात को जागना ही क्यों? Right?
And
मतलब
one more thing, sir. I want to add that we if we sleep late, the cancer cell will multiply in our body.
very true.
So we have to sleep earlier as possible as.
हाँ. और वो क्या कि फिर वो जो गोल गोल आंख वाला बर्ड है, राइट? कोई अपने को ऐसा बोल जाए.
उल्लू आउल
मतलब मैं थोड़ा ऐसे गाली दे सकता हूँ किसी को.
Sir, I have also heard that if you cut off sugar intake, you'll lose your weight very faster.
Very fast. Sugar and salt, right? Sugar and salt if you cut. And in salt, it is the sodium chloride, right? Not the potassium chloride. Sodium chloride is अपना का टाटा का शुद्ध नमक वो वाला सफेद नमक. That is very bad because the amount of sodium that is so much. We'll see the sodium potassium exchange, right? That the transport pump, how it really happens.
The sodium potassium pump.
Yes, because
Sodium
it leads to collection of fluid into your body. Excess sodium is a universal rule याद रखना. Water follows sodium. The moment there is increase in the sodium, the amount of water starts getting accumulated. Now the arteries तो fix है, right? It is not so that the new arteries will be generating. So that means it is a fixed space in which now there is more fluid. तो क्या हुआ? Pressure बढ़ा. There is increased blood pressure, right? In youngsters, this is something what is happening because अपना pizza, burger, फालतू ये जितनी भी चीजें हैं, they add extra salt and they don't add potassium chloride because potassium chloride is not that tasty and you have to add it in more amount. At the same time, it is more costly. So they go for sasta namak. This sasta namak, it will be leading to, because almost every youngster today, it is getting 10x, 10 times more sodium chloride, unless until they are so conscious and they cut it off completely. But it is so dangerous. Similarly, all those so-called energy drink, मतलब अपना ये Red Bull, right? कि जो मतलब ad वैड दिखाते हैं, right? Red Bull gives you wings. अब wings क्या? It is having so much of caffeine and so much of sugar. मतलब इतना burn करना ही हालत खराब हो जाती. We do drink, right? We do drink this Red Bull, but I told you that in marathon on the 38 to 39th kilometer in Tata Mumbai, they give you Red Bull, 39th kilometer, because by that time you are so exhausted and humidity is so high in Mumbai, and then you cross that Pada road. So by that time you are almost gone. So फिर भी अभी 3 किलोमीटर का बाकी है run. So that is where they give you this Red Bull. So ठीक है. Now it is like a top final sprint खींच डालो. So but then they never give post refreshment, post race कभी Red Bull नहीं. They give you fruit juice, they give you apples, they give you those मस्त पनीर का wrap, all those things. Like अब यार खाने का मन हो गया. So I think अब परसों मिलते हैं.
So,
Excuse me,
sir,
sir.
KCl is better than NaCl to eat.
हाँ केसीएल ये मतलब अपना जो पिंक सॉल्ट नहीं बोलते, पिंक सॉल्ट,
हाँ.
हिमालयन सॉल्ट.
Which is iodine, that one?
आयोडीन इसमें होता है यार, ये सोडियम क्लोराइड में आयोडीन वाला ये,
Okay.
right? In this iodine is very less, but see don't worry about it. आयोडीन तो it is वीक में एक बार वो चुटकी भर वो ये ले लो, ये सोडियम क्लोराइड, बस that is sufficient.
Okay. So that
Excuse
kala
me.
namak which is in the rock form, that one?
हाँ मतलब वो तो सबसे अच्छा काला नमक, रॉ फॉर्म, दैट पत्थर जैसा. But आजकल तो सब मतलब people use that very finely grained, right? All sorts of नमक वो डाल रहे हैं, वो सैलेड पे खट टेबल पे पड़े रहते हैं होटल में, right? People use it and then they suffer from so many things.
I've convinced my mom to put pink salt in all dishes.
Very nice. मैंने तो
Excuse me,
even
sir.
मेरे यहाँ जो काम कर रहे हैं ना, मैंने उनको भी बोला कि दोस्त मैं देता हूँ, you replace. So they replace their sodium chloride with potassium chloride.
Yes.
Sir, we already used that pink salt from since my grandmother's generation.
Very nice. Okay, so wish you a very happy lunch.
Sir,
Hello, sir.
बोलो.
sir,
I,
I have
I
a
had just
question.
one.
अच्छा Sakshi and okay Sakshi you go ahead. Then I think Manthan
Yes,
was.
sir, I have a
Yes, yes.
question. Like, as we were talking about cancer before, so it is related to that.
Uh-huh.
As in some cases of cancer, chemotherapy and radiation responds well. Like, it gives a positive result. But in most of the cases, it doesn't respond. Like, it tries to resist it. Why it happens?
See इसके लिए That's why staging is needed. Staging, right? Staging is when there is mass, right? There is cancer, but it is primary. There is no metastasis. It has not spread to any other area. Second, when it has broken, the wall is broken, but still it is not present. But the lymph nodes are enlarged. Lymph nodes, they are enlarged. So in cancer, lymph nodes, they become very prominent. Then lymph nodes, they become stony hard. And at the same time, the opposite group of the lymph nodes, they are also involved because lymph channels, they are connected. Then it is that there is remote metastasis. Remote metastasis is that if that female is having carcinoma of uterus, and then the metastasis is in brain. So that means it has traveled such a long distance, so chances are very high that multiple organs must have been involved. When multiple organs are involved, so that thing is what lead to bad prognosis. So that's why in carcinoma, there is radiotherapy that is called as RT, there is chemotherapy that is called as CT, and the third thing is surgery. Right? It is the combination of all these things. Radiotherapy and chemotherapy, they come under conservative treatment. Conservative means you don't want to explore, cut the body, try to manage, right? But when that thing goes, and sometimes they are in support to each other. Say, for example, you come across a tumor which is vascular tumor. Vascular means it has got rich blood supply. So if you cut it, then there'll be explosion, right? There'll be so much of blood which will be coming out. So with the help of radiotherapy, that is what is called as the ablation. So you just cut down its vascular supply so the tumor would shrink. And then you do the surgery, your surgery would be more effective. So that's why you have to take a call that what exactly to do. Chemotherapy, if the patient is very weak, there is no point because as such chemotherapy will be affecting the neural system and the immune system very strongly. So patient won't be able to take the brunt of it. As such, hairs are lost, skin goes bad, right? Entire energy level drops, patient is unable to eat, keeps on vomiting. And if patient is already that weak, and if you give chemo, so it is of no use. Patient won't be able to sustain it. So that's why staging is very important.
So can it go to the skin too? Metastasis, status skin.
It can.
Skin पे भी चल सकता है.
हाँ.
Okay. Because my
Skin means
father's
you are.
brother sister.
हाँ.
Brother.
हाँ बोलो.
Right. बड़ी मम्मी मेरी उनको भी like uterus cancer हुआ है. So they really like it now. She वो skin
Your voice is coming like a telegraphic message, right? Choppy. Anyway.
Right now?
Send a mail.
Is
Send
it
a mail
okay?
to me. Now it is okay.
Sir, I was just saying that does it go to the skin too? Because she had to have a surgery to remove the skin plus uterus. It was very long surgery. Takes 10 hours.
Yes.
So how can someone remove the skin?
There are skin. So that patch is to be removed. There are epithelial cancers and they do occur and they are so dangerous that when we'll be learning dermatology, right? During dermatology, I'll be showing you pictures of that. But आप खाना ना खा सको. It is that dangerous, that bad.
He is in intensive care right now.
Yes. Liver cirrhosis, that's right. This is your Tracy. We talked.
Sir, the upper limb first lecture is the pectoral region one, right?
Pectoral region. Chest.
Okay.
So what is PET scan? I had
PET
a
scan
project
is
on it.
PET scan is PET is positron
Emission
tomography.
something. Tomography.
Right? Positron emission tomography. So this is where the radiation is used. Now, even SPACT has come. Single positron emission computerized tomography. It's called as the SPACT scan. So this is where, say, if this is a tissue, right, then many of they are called as the markers. Right? They are called as the markers. So wherever we'll be using the word markers, markers means if you inject that tissue, right, say for example, deuterium, which is radioactive. So, but wherever the tissue is there, the tissue tissue is having strong affinity. Affinity means love. So tissue has got strong affinity for this deuterium. So it will attract and it will accumulate. And with that gamma scintillation cameras, when you take a picture, right, you'll be able to see that this is how those images they look like. So if this is a kidney, then it would really look like this. So this is what is called as the hot area, right? It has got nothing to do with any other hotness, but this hot area means the marker is getting collected. That means this is that type of tissue for this particular marker. Then there can be some cold areas. Cold areas means on those areas, this marker is not reaching at all. So either there is, because this marker means it is the chemical. It is, right? It is a chemical. So that has been injected into the blood. So if there is any area where the blood is not reaching, so obviously that area will be completely looking dark, black. And these positron, this patterns SPECT scans, so they are in color.
Hello,
So,
sir.
sir, different colors indicate different
There are
signals
just
and
two, three colors only.
okay.
Acha, Dhruvi, send a message, email to you.
Sir,
Huh?
so for me, it's not, they're not telling me September intake. They're telling me a little late, October, November. Is it normal?
Yeah.
It is. Okay.
Hello, sir.
Bolo.
हाँ
Yes.
हाँ yes. I'm Manthan Suryavanshi. Good morning, sir. I
Good morning.
just joined the lecture a bit late. I think 10:30, 10:50 something. So I just wanted to ask, did I miss anything? Or will you upload the PDF and I will get back right to it?
For today, there is no PDF, just one task, and that task is you have to watch that I told you, na YouTube
The
video.
upper limb part, yes, yes.
Upper limb. So you
Yes.
are with the batch. You are with everyone.
Thank you.
Otherwise, so even I also don't remember what I talked between 10 and 10:30. पता नहीं गालियां दी थी सबको.
So we just discussed the parts
Discuss
like
anything.
pleura
You
and
just
all
said
that.
ki you
Yeah, you
talk
just
for
said
email.
you just unmute yourself and speak up.
Okay, then I didn't miss anything.
Sir, and also I wanted to ask, there's this assets link where you post everything, right? The PDFs and everything. And there's just one link, right? No two links or something, because I got to know there are two links. That's what.
There's just one link.
Okay.
चलो अब मैं खाना खाने जाऊं.
Yes, sir. Thank you, sir.
Yes, sir.
Yes, sir. Bye.
Okay, sir.
Yes, sir.
Thank you, sir.
Bye, sir. Thank
Bye,
you,
sir.
sir.
Bye, sir.
Thank you, sir.
Have a good day, sir.
Take care.
Bye, sir.
Bye.